rampant mindless FUE technique, rampant mindless FUT technique, both these techniques in wrong hands are bound to leave big scars. Earlier there used to be a dictum that big surgeons leave big scars. This is no longer tenable. No one accepts big scars, especially in cosmetic surgeries. There is a flux of scarring because of improper technique, doing procedures in a rush because there are so many others waiting outside for their turn, and this mostly holds true for FUE procedures. But FUT procedures also cause big scarring. With FUT becoming less and less popular as a technique all over the world, the number of scar cases from FUT that come to us for revision are decreasing. Just 10 years back, I used to be repairing almost like 5 or 6 scars every month. But now there is 1 or 2 scars every other month. So you can see that FUT as a technique is waning in popularity, whereas more and more FUE cases are being done. A badly done FUE technique is beyond repair. The scars that it forms in the donor area cannot be repaired. They can only be camouflaged by using scalp micropigmentation, and still they may be visible. A person with bad FUE scarring in the donor area cannot wear his hair long because there is patchiness. Not only scarring, but patchiness gives a very unaesthetic look. In FUT scars, on the other hand, the scars can be hidden very well. However, all scars from FUT are not amenable to treatment. Also, scars from FUT cannot be made invisible after the repair procedure. The commonest technique to repair a scar after FUT procedure is z-plasty, or what is called as w-plasty. And in this video, I show my technique of w-plasty, in which multiple Zs, multiple Ws are excised, the wound is triangulated, there are multiple triangles, and these are coapted and stitched together. The linearity of the scar is broken, and to the naked eye, the scar is much less prominent than it was before. But in cases where there is less skin laxity, we have two options. One is to do scalp exercises and make the skin lax over a period of 3 to 6 months, and then go in for excision and closure, or if the scar is not too wide, to implant hair. Now, since the scar tissue is pale in comparison to the hair, it is paler in comparison to normal skin, even after implanting a lot of grafts, still only about 60% of the visibility is decreased. Moreover, in repair of FUT scars, it has to be kept in mind that the scar is supple, that the scar is no longer pink, that the scar is not too thick. It is not a hypertrophic scar, it is not a keloid. So for a scar to be supple, it takes about 18 months to 2 years. And that is the time a scar can be repaired using FUE technique, using grafting of hair either taken from the shadow area of the beard or from the scalp. Many times when the patient is extensively bald and these precious grafts are to be utilized elsewhere over the scalp, it may not be deemed fit to do a hair transplant over the FUT scar. In such cases, scalp micropigmentation comes out very helpful. Very small scars from FUT are best dealt with scalp micropigmentation and not by grafting. If you have any further queries about scarring in the recipient area, in the donor area, or about hair loss and hair transplant in general, let me know and I'll be happy to answer. God bless you.
I would certainly recommend Diamond Goods. Very competitive on the price compared to many other companies out there. It's there's no comparing the price, and you know, the quality and the professionalism way exceeds, you know, what I expected. So yeah, I would definitely recommend Omnibus to, you know, be recommending to any friends, family who may wish to do it also.
Okay. Thank you so much, Jay.